Okay. So first looking at the main question, right? So
Mhm.
which of the following is the most likely diagnosis? So we're looking at that. And then skimming the answer choices. So hepatic adenoma with hemorrhage, hepatocellular carcinoma, focal nodular hyperplasia, liver abscess, hepatic. So it's like related to the liver.
Okay.
So that could be one thing. And then reading the case. So a 34-year-old woman presents with acute onset of severe right upper quadrant pain. She has been taking oral contraceptive pills for the past 8 years. On physical exam, she is in significant distress in her abdomen and is tender to palpation in the right upper quadrant. Lab tests show a mild elevation of liver enzymes, and an abdominal CT scan reveals a large heterogeneous mass in the right lobe of the liver with surrounding blood. Um, so looking more closely at the labs, so elevated liver enzymes, no imaging, or there is imaging, sorry, CT scan. Um, so now looking at the answer choices again. Kind of thinking through the answer choices. I don't think that there's necessarily a sign of like a bacterial infection. So I kind of steering away from liver abscess. Um, but her history of oral contraceptive pills, maybe that puts her at risk of I don't remember which one exactly, but maybe the hepatic adenoma.
Okay.
Um, so that would be probably my gut answer.
Okay, good. Okay.
Uh,
Now
with
you have
hepatic,
to ask yourself, do you want to keep it or change it, right?
right. Um, so far, hepatocellular carcinoma, I don't know if there's enough information to really gauge that. Um,
Okay.
and then, yeah, I think I would stick with that maybe, but
Okay,
I'm not
perfect.
sure.
Yeah, that's okay. So this is test taking strategy. You're not sure, but that's your gut, so you're not going to change it, right? That's the key here. Okay. But let's work through this question together and I'm going to give you a different kind of more clinical standpoint. Okay. So 34-year-old woman, right? So acute onset of severe right upper quadrant pain. So this is super important, right? Female, like I said, middle-aged woman, right? But also on top of that, I want you to remember, right, that when you're reading these questions, you should be thinking it's acute versus chronic, right? What is it, right? So in this case, right, they tell you it's acute, which then narrows the diagnosis down, right? Acute changes because if it's acute, do you think it's going to be cancer?
No.
No, right? So you can already think, okay, so it's not that, right? She's taken oral contraceptive pills for the past 8 years. So exactly what you're saying, right? Oral contraceptives is a risk factor for actually hepatic adenoma. Okay, so that's a risk factor. She's in significant distress, of course, is acute, right? Abdomen is tender to palpation in the right upper quadrant, right? So liver area, so we know that. Okay, lab test shows a mild elevation of liver enzymes, right? And so if it's only mild, right, do you think if you had a liver abscess, if it's going to be mild or severely elevated?
Probably severely.
Probably severely. And they're probably going to say she has fever, right? She has a white blood cell count, right? She might be hypotensive because she's septic, right? So doesn't really fit the picture. Okay. An abdominal CT scan reveals a large heterogenic mass in the right lobe of the liver with surrounding blood. Okay. This is something key, right? So if you see the surrounding blood, what does that correlate to?
Probably hemorrhage.
Yeah, hemorrhage, right? Meaning you're bleeding, right? So as far as you know, right, this all points to A, right? Of course, right? And so let's see kind of, how our handiwork is. So A, does it make sense kind of how we work through that?
Yes, it does.
Yeah, so you can see that if you thought about it more clinically, right, it's going to become a little bit more easy, right? But if you start searching for buzzwords or things like that, because even if you didn't know that oral contraceptives was a hepatic adenoma, you can look, oh, there's hemorrhage, it's acute, right? All these things will lead you more towards A. Okay.
Okay. Yes.